I'm Roberta Levin, and I will be your professor for your health policy course. I would like to welcome you to the class and hope that you are going to enjoy the course. There's going to be some flexibility and some things that I expect everyone to do. But overall, I hope you find an area of healthcare policy that is of interest to you and that you can try to focus your attention in on that area that you find interesting. During the course, one of the things you're going to do is write a health policy analysis. But before we get to that, you're going to have a couple of lectures that are going to explain the difference to you between a health policy brief and a health policy analysis. Both are very useful, but they're different in their purpose, and certainly in the depth into which you have to go into the literature. For many graduate students, the significant difference is a brief really is brief. It's a couple of pages, and a health policy analysis can be long. It won't be that long for the purposes of this course, but in reality, they do tend to be significantly more detailed. We're also going to discuss legislation and how legislation can actually impact policies that are written, and then those policies can impact your practice. In the end, we're going to talk about some areas that would be of interest to all of us. So one of your textbooks, the Mason book, has multiple different topics. And I'm going to let you, in those last couple of weeks, select the readings that specifically interest you in your area of research or practice. So this is our first week. And in this first week of class, it is primarily about the orientation, making sure that you understand the syllabus and that you read and familiarize yourself with the concepts of healthcare policy. There is quite a bit of reading in the course, and there's several books that are assigned, and you really are going to read the majority of what's in those books. But if you're in the orientation, you're halfway there. Well, you're kind of halfway there. You at least have shown up, you've taken an interest in this area of study, and I think when we're done, you're going to understand that it gives you a great deal of control over your own future. This week, you're also going to have two discussions. In the first discussion, I asked the question, what's an area of policy that has impacted your practice? I suspect for the nurse practitioners, this is going to be a much easier question to answer, or at least for those of you who want to be nurse practitioners. For the doctoral students that have a research focus, it may be a little more complex to answer this question. It may take a little more thought to say, how does it impact me? But I think if you get into the reading, especially the book by Henshaw, you're going to quickly figure out why. And then the second question is to ask us all, what is the status of the U.S. healthcare system? And how have expenditures impacted the cost? And by the cost, I mean the cost to the average person for healthcare, the cost of healthcare as a total. And I want you to all know what's expected of you in the class. I want to be crystal clear about what I want and what I expect from each of you. I don't believe that learning should be stressful. I think it should be exciting and it should be fun. There should be no surprises in this class. You're here to learn, and I'm here to facilitate that learning. So let's start with the syllabus. The syllabus provides an outline of the expectations, but it's not set in stone. If you tell me your concerns, or if there's anything that I didn't cover in the syllabus, that I'm not covering in the class that's of interest to you, let me know, and I will see what I can do to make adjustments. We will use the Advanced Practice Registered Nurse scope of practice as independent practitioners as an example throughout the semester. But there will be many other examples of how policy impacts health and how research should drive policy. We are going to explore how one action, such as limiting scope of practice, can impact the ability to adequately implement other policies. We're going to look at policies that seemed like a good idea and failed, and we're going to look at policies that worked one place, but when they've been implemented in a different place, they did not work. We want to make sure that we understand how you decide what is evidence-based. I hope that you will leave this course able to make policy and to defend it. So please read your syllabus carefully to be fully aware of the expectations, the assignments, due dates, and grading. The key assignments are the policy analysis paper, and I'm going to have you turn in sections of that every couple of weeks so that you're not trying to write the whole thing at the end. I want this to be a thoughtful and a learning process. We will have discussions most weeks, but not all. There will be a student-led presentation that is individual assignment, and then there will be a group presentation at the end. So we will divide up in groups. I have posted sign-up sheets for you, so you're going to need to go in and sign up for a week and or a group. Now let me clarify a couple of the assignments. The discussion board assignments are required, but sometimes you're going to want to know more or interact in a non-grading, non-stressful manner. My plan is to hold weekly Twitter chats to answer your questions and discuss what interests you using the hashtag health policy. I hope this will give us an opportunity, since we are at a distance, to communicate, to discuss policy in a manner that is more open and flexible. Most people have Twitter accounts. They're easy to use. Nobody's expecting perfect spelling or perfect grammar or anything else. So it gives you an idea to see what other people think. Those Twitter chats aren't required and they're not graded. But for some people, they will be helpful. In your learning modules, you will have lectures, notes, videos, and articles and websites. Not all weeks will you have all of those things. You will almost always certainly have lectures. Those will usually be done like this. Some of them will be videos. And sometimes I just post notes that I find are helpful or when I think you need more clarification. In the discussions, they will vary. Sometimes they will be on my gateway. Less formal discussions through social media. One of the reasons I like social media for discussions is people tend to check it more often. They use it. It goes straight to their cell phones. Most people interact more frequently and more freely on it than they do in the discussion boards where people get really formal. And it's not quite like a classroom discussion would be. And I want discussions to be serious and learning, but I don't want you to feel like every discussion board is writing a mini paper. I really do want it to be a discussion. You may also get feedback from other people that join the conversation. Sometimes the view of the random stranger is as helpful as that of the professional, and you need to know what the public thinks. It's one of those things that I've been reminded of in my career, is that the mean isn't necessarily me. Just because I believe it doesn't mean that the average person on the street that's not a policymaker or in academia believes it. So sometimes we need reality checks about what the rest of the world believes and thinks about a policy. So Policy gives your work impact. This class is going to provide you with the tools and the skills to give your work in your DMP and your PhD program impact. The ability to influence policy helps you to control your own future, to drive the agenda, to change policy that can make your research have greater impact and address practice issues that limit practice or adversely impact the quality of care. In essence, we can do wonderful and amazing research. We can implement great projects in our clinics. But if we don't change the policy, we're really not doing all we could do. So it's important, if we want our research to be implemented, that we have to worry about the policy and how your research is going to get translated into policy. How that initiative you took in your clinic, in your facility, how that gets translated into a policy so everybody at the clinic is implementing it. And so if you leave, the policy doesn't leave with you. It's my pleasure to welcome you, and I look forward to our time together. So let's learn how to make the world the beautiful place that we want to photograph. I'm here to help you through the class. I'm easy to get a hold of electronically. You should have on the syllabus my Skype address, you have my email, you have my phone number, you have my cell phone number, you have my Twitter address. So there's no reason that you shouldn't be able to get a hold of me. I can tell you that my weakness is I'm not good with voicemail that you leave on my office phone. So if it goes to voicemail, you're better off to just call my cell phone, or if you send me a text message and say, call me back, I will do that. I look forward to the class and to meeting and hearing from all of you. Enjoy and have a great day.